Hi, I am Dr. Stephen Brazis, and I'm here today with my very good friend Dr. Sean Rhee, a periodontal specialist in Sacramento, California. Hi, Sean. I want to thank you for welcoming me to your office today to go over these questions about dental implants.
Well, thank you for having me.
Dr. Rhee is a graduate of the University of California at Berkeley for undergraduate studies and then went on to dental school at the University of Southern California School of Dentistry. He then decided to specialize in periodontology and completed his specialist training, graduated from the University of Southern California School of Dentistry in 2006, a board-certified periodontist. He practices at 2525 K Street in Sacramento, California. His office phone number is 916-444-7460. So, Sean, again, welcome and thanks for being with me today.
Thank you, Dr. Brazis.
Now, Sean and I are here today to go over and clarify some questions that we've heard many patients ask about dental implants. So let's just get right into it. Sean, I'm going to ask you some questions as if I were a prospective patient considering dental implants, and if you would, just give us the answers as if you were as you would for any patient in your office.
Okay.
So, Sean, what is the process that I would go through if I were considering dental implants here in your office?
Well, first, you want to start with a consultation discussing all of the treatment options that's available, talking about the advantages and disadvantages of each treatment. Another important thing to go through is having a thorough dental and periodontal examination and also reviewing your medical and dental history.
All right, John, well, you mentioned medical history. What medical conditions would affect my ability to tolerate implants? And are there any significant risks for a healthy person with implants?
Well, first of all, dental implants success rate is extremely high. It ranges from 90 to 95% on a healthy individual. Of course, there are some risk factors that can compromise the outcome of the treatment, such as if you're a heavy smoker, uncontrolled diabetics, poor oral hygiene care, if you tend to grind your teeth or have a very strong bite of your mouth or of your teeth, and also the history of head and neck radiation therapy in the past can compromise the treatment of dental implants.
I'm glad you mentioned that about the grinding, because that is one thing I run into a lot with my patients as well. And how long does the process take from beginning to end, Sean? I know there's a lot of different answers to that, but if you could kind of clarify that for us a little.
Well, traditional protocol, if the patient presents without a tooth and if they don't need any additional bone augmentation procedure, it usually takes about 4 to 6 months for the implant to heal before your general dentist can place a crown on top of the implant. Of course, this time frame can vary quite a bit depending on how the implant procedure is done, but typically it's usually 4 to 6 months.